What would you like to see the government doing in this space?
I think there's probably a few elements to it. One element is, I think that kind of more proactive system. So if you're bothered about employment, I think you need to be much more extreme in trying to stop people falling out of work in the first place and more protective of their health. There's a bit of a challenge of actually understanding what is happening to the health of the population. Because I think the data we have on mental health isn't great. It's affecting people when they're very young, and that could have really big, serious implications over the coming decades. So if we're not getting to grips with that now, could be an even bigger problem in the future. So that's why things like in the Green Paper about reassessing how PIP should be designed is actually quite a good idea, I think, to sort of get into a proper conversation about what are the needs of people and what do we need to support, rather than what tends to be, and making big cuts to benefits reinforces it, tends to be quite a cautious discussion and defensive discussion about protecting entitlements. And probably at a further level is a bit of recognition that we're in an ageing society now. We'd expect some growth in spend on these types of benefits as we're getting an older population, but it seems to be something we're not particularly prepared to pay for.